Now, have you thought about those other medications we talked about? So you've used the patches. Did you go down to the chemist and have a look
I didn't.
at the other things? You've probably been a little busy. Okay. But do you remember the pictures we looked at online? And there was the inhaler, the nicotine inhaler, which some people find a really great substitute. There was the oral film. Do you remember? It's a bit like a breath mint film.
Oh, yeah, that kind of,
yeah, that one. There's gum, lozenges, or sprays. If I said you have to choose from that, not you have to, but you know, what do you think would suit you best?
I feel like maybe the gum or the lozenges.
Okay.
Something that's not quite so obvious, maybe. I feel like the inhaler is a bit obvious. So something that's a bit subtle, you know, I can just pop it in my mouth. And,
I mean, could you see yourself going for coffee with your smoking friends, sitting upwind, I think, and having a piece of gum and maybe saying to them you're trying to quit, and would that be awkward?
I guess I could, yeah.
Have a think about it. Now, do you remember the other drugs, other pharmaceutical, drugs we talked about that help quitting? And you remember the long names, varenicline. That's that Champix tablet that you take for a couple of months, start a lower dose and then step up. And then there was the other one, Zyban or bupropion, which is actually an antidepressant, but it's very well established in smoking, helping people quit. Have you had time to think about either of those? Do you know anybody who's taken either of those?
I don't. I think I'm probably, initially I was reluctant because I wanted to just use the packs and I didn't want to take medication if I didn't have to. But I think given the fact that I sort of have given it a go and I managed a week.
I don't actually think you've exhausted it because most people need a few goes and that was short term, and the fact you're down to 3 is very impressive. Look, what I want to just repeat, just so you really know the background, is the likely benefit of all of these drugs. And I guess the first point I want to make is because you have lung cancer, and I'm really sorry about that, but it's really important for you to quit because it will improve your survival. And you might remember that graph I showed you that from that study that showed across all stages that smoking cessation does improve survival. And there's a lot of science behind that, but we don't need to go into that too much today. If a study came out a few years ago that compared varenicline with the bupropion tablet and with nicotine and with placebo or nothing or going cold turkey, and showed that overall to help people stop, the varenicline did best, the other two were about the same, and all better than cold turkey. Having said that, most people around the world do quit without drug help, but you're in a very special situation. And I think you should first congratulate yourself on how well you've done and then harness that momentum to basically ramp it all up, which means I think that we should probably think about going onto the Champix and maybe give you a script today.